Good day everyone, I am Myra Justin B. Dinorian. Today I am going to demonstrate to you the procedure on how to assist client on ambulation only using crutches. But before that, we are going to do an assessment, which is to assess the length of time in bed and amount and type of variety that the client can tolerate, baseline versus range of motion of joints needed for ambulation, and muscle strength for lower extremity clients' intake of medication, and the level of comfort of the patient. So, since we are all set, we are now going to proceed to the procedures. So, for procedure number 1, review the medical record and nursing plan of care for conditions that may influence the patient's ability to move and ambulate. Assess for tubes, IV lines, incisions, or equipments that may alter the procedure for ambulation. Assess the patient's knowledge and previous experience regarding the use of crutches. Determine that the appropriate size crutch has been obtained. So first, we are going to check the medical record. Okay. So now we are going to determine the appropriate size of crutch. So it's okay. So this is to ensure the safety and not harm the patient and clear patient for ambulation. So appropriate size of the crutch for the patient can help aid in the effectiveness safety of use. So we are now done checking the size. Let's proceed to the next procedure. So for procedure number 2, perform hand hygiene. Put on PPE if indicated. This is to prevent the spread of microorganisms. Now I'm going to use an alcohol-based hand rub. So, for procedure number 3, identify the patient, explain the procedure to the patient, tell the patient to report any feelings of dizziness, weakness, or shortness of breath while walking. Decide how far to walk. This is to raise awareness for the patient and have coordination with the nurse to determine how much the patient can handle the ambulation and have adjustment. So good day, ma'am. I am Myra Justin B. Tenorio, your nurse for today. What's your name, ma'am?
Andrea.
So, asa the birthday, ma'am? So today, ma'am, we are going to walk using crutches. Okay lang ba? So, naka-experience ani, ma'am. So, I'm going to assist you, ma'am, ha? So, if you feel any dizziness, kanang lightheadedness, immediately tell me, ma'am, ha? So, okay. So, for procedure number 4, encourage the patient to make use of the stand assist device, if available. Assist the patient to stand erect, face forward in the tripod position. This means that the patient holds the crutches 12 inches in front and 12 inches to the side of each foot. This is to prevent strain in muscles and to aid in maintaining the balance. So, now I'm going to assist the patient to set. So, ma'am, I'm going to put your feet, ma'am, ha? So, 1, 2, 3. So, okay lang ka, ma'am. So, I'm gonna assist the patient in putting on non-skid shoes. So, we are done. So, magtindog tayo, ma'am. Okay lang, makakagibate. So, 1, 2, 3, go. So, I'm gonna let the patient hold the crutches. So, here, ma'am. So, for procedure number 5, for the 4-point gait, have the patient move the right crutch forward 12 inches and then move the left foot forward to the level of the right crutch. Then have the patient move the left crutch forward 12 inches and then move the right foot forward to the level of the left crutch. So, ma'am, I would like you to move the crutch first, then your right foot, left foot. Yes, ma'am, good. So, this provides at least 3 points of support at a time. Then continue. Left turn, ma'am. For the 6th procedure, for the 3-point gait, have the patient move the affected leg and both crutches forward about 12 inches. So, have the patient move the stronger leg forward to the level of the crutches. So, ma'am, we are going to move the crutch and the both the crutch and the right foot forward. 1, 2, so let's turn left. Okay. So, for procedure number 7, for the 2-point gait, have the patient move the left crutch and the right foot forward about 12 inches at the same time. So, have the patient move the right crutch and left leg forward to the level of the left crutch at the same time. So, now we are going to transfer the gait to the other side. Okay, then I'm going to then I'm going to assist to the other side. So you need to have the patient move the right crutch and the plug forward to the level of the left crutch at the same time. This is to have faster movement than the 4-point gait. So okay, ma'am, we're going to move the crutch and the left foot and the right foot. The crutch, left foot, snap, and let us turn, ma'am. So, for procedure number 8, for the swing to gait, have the patient move both crutches forward about 12 inches. Have the patient lift the legs and swing them to the crutches, supporting his or her body weight on the crutches. This is to carry the body weight of a paralyzed leg and hip. So, assuming that there is another crutch here, we are going to move both the crutch forward. So, 1, 2, nice. So, now for the, are you okay, ma'am? Okay pa ka? So, for the next procedure, for procedure number 9, continue with ambulation for the planned distance and time. So, we are done. Let us return the patient to the bed or chair based on the patient's tolerance and condition, ensuring that the patient is comfortable. Make sure call bell and other necessary items are within easy reach. So, after that, we are going to return the patient and ma'am, that's only okay ka, ma'am? Wala yung sakit? Okay. So, going to take it. So, kung saan man gusto ko malingkod or magkana ng malingkod ka. Okay. So, make sure that the call bell and other necessary items are within reach. So, ma'am, ano yung call bell, ma'am? Ha, dali lang siya nako ikutang, ma'am. So, this is to let the nurse respond immediately when the patient is in need for something. So, comfortable na ka, ma'am. Do you need anything? So, okay, ramang kahapit ka. Okay. So, for procedure number 10, remove PPE if used. Then perform hand hygiene. This is to prevent the spread of microorganisms. Then again, I'm gonna use an alcohol-based hand rub. So, that's it for today. Thank you for being with me.